Hi, I'm Dr. Jim Carlson from Riverside Animal Clinic and reporting today from my daughter's horse show. I wanted to get a few of the cases reported. We're reporting on 02056. The base point study, as you'll notice, you'll get a copy of this in the email, is first of all, we can see that most of these are in green, so most are balanced, but we see there's 2 weak points, the urinary bladder and nervous system, and then 1 stress point on the other side is fatty tissue. So how this lines up is the nervous system is connected to the urinary bladder, and if the urinary bladder and nervous system are weak, it's going to send a weak detox signal, and some of those toxins can then be stored in fatty tissue. They're usually deactivated, so they're not causing any trouble. But whenever we're looking for root cause problems with the symptoms that we're seeing, is that it's really important to know what the underlying cause is, whether it's directly related or not. So we're going to use a microinfusion to correct these imbalances. It's going to be 5 drops a day for 3 months. And we'll go into the base point readings next. Be sure I had that up there. There we go. Now, you'll also receive this in email as well, is that the base point readings, they go into the groups, and then the next line, this hashtag is food, for example, and then it goes into a miscellaneous file. We see there's quite a few of these are balanced just fine. Then we get down to food. We can see supplements, sugars and sweeteners, and also spices. And then it'll open up these files to show us specifically what we're looking at. And this one was food and also fish. So fish sensitivity. You notice on the base point reading that we're not allergic to these items, just sensitive. The spices, these are not things that we would necessarily be exposed to, but if we were, sorry about that, my Siri went off here for some reason. There we go. All right, get back to that. There we go. Get back down there. These aren't things that we would necessarily be exposed to, but if we are, like spices, for example, cayenne pepper would be only useful if you were using cayenne pepper in the household and had used the product, and then there would have been accidental exposure. So review the spices, just really looking at if you use these spices yourself as a potential exposure, that could cause some problems. And then the sweeteners, going down the list, and also supplements. Supplements are going to be things you want to check at the bottom of the food label, and also any treats or supplements that you give as vitamins or nutritional supplements, because that's where you're going to find a lot of those, like lithium and magnesium. But fortunately, a relatively short list. No major food sensitivities. These are things that usually are easily avoided. And so the remedy right now to resolve the current imbalances is we're going to use 5 drops of a hemp oil infusion once daily for 3 months, and that'll correct the imbalances. And then we'll be getting in touch with you. Nancy's doing the testing right now, and so she's going to make the infusion, get in contact with you this coming week. You should be seeing this in your email, the test results, and also the video as well. So if you have any questions, give us a call, 815-344-7716. Thanks.